Hello and welcome back to the channel. It's Nesben here, and in this series on heart failure, we'll be looking at a very important medication that is used in the treatment of heart failure, which is digoxin. So we have started a series where we are trying to tackle heart failure and the things we need to know as nurses. Now, one of the main things we do as nurses is to give medication for this condition, and one of the medications we use a lot is digoxin, which trade name is naloxone, but you'll find most nurses on the floor call it DAGE. Now we want to understand what this medication does and why it's important in heart failure. If you are new here, thank you for choosing to watch this video. To my returning subscribers, thank you for staying with me. I hope you find value in this video, and if you do, please give us a like, share this video, subscribe so others can also benefit just like you have. So let us now move into the topic for today, digoxin. One of the things we need to establish when it comes to medications is what class of medication it is, because that helps us to understand its uses and what other medications can be given alongside that. So digoxin belongs to the class of medication we refer to as cardiac glycosides. So because it belongs to the class of cardiac glycosides, then it means that it works on the cardiac muscles, or it works on the heart. Now, every cardiac drug usually have three characteristics. So it can either be positive or negative, but the three characteristics are inotropic effect, which just increases the contractility of the heart. You've got chronotropic effects, so which is dealing with the rate, so the heart rate, and you've got your dromotropic effect, which usually tells us how electrical impulses travel through the heart. So with digoxin, it's got a positive inotropic effect. What it does is that it increases cardiac contractility. So the force with which the heart pumps blood is increased. It's got a negative chronotropic effect. What this does is that it reduces the heart rate. That's why it's usually used in heart failure. And also it's got a negative dromotropic effect. So it reduces how quick signals or impulses travel to the AV nodes. The AV nodes usually are below into the ventricles. So those ones are what tells the ventricles to contract and relax. So one will ask, what are the uses of digoxin then? In which situations, in which conditions can we use digoxin? So digoxin is used to reduce blood pressure. And how it does this is that it allows for the heart to contract effectively, and so it doesn't have to keep contracting very quickly, which would lead to some form of tachycardia, but rather it allows the heart to contract well, so there's a good amount of blood that is leaving the ventricles when the heart actually contracts. It's also used to reduce or regulate the heart rate, usually in atrial fibrillation, where the heart is beating very quickly. Once you give digoxin, because of its negative chronotropic effect, it reduces the heart rate, and also it helps you to maintain a good rhythm, and usually that's because it's got a negative dromotropic effect, because in heart failure usually the heart is beating quickly trying to compensate for the oxygen rich blood that is not getting to the other parts of the body. And so digoxin allows for you to have a good rhythm and for the heart to pump well and effectively whilst reducing the rate. So it helps you maintain a good heart rate and rhythm and allows for enough blood to be pumped out of the ventricles. Now, with every medication, you've got contraindications. And so one of the contraindications for digoxin is acute myocardial infarction, so an acute MI, and also ventricular fibrillation. Now, the reason why this is so is because when you give digoxin in the presence of these conditions, it tends to rather worsen rather than improve the condition. Now, I would like to talk about something we call the therapeutic ranges. So with medications, we've got therapeutic ranges. So at certain levels of the medication in the blood, it means the medication is going to be effective. Above certain levels, it can become very toxic. Now, digoxin is one of those medications that has got a very narrow therapeutic index or a narrow therapeutic range. And so if that is not monitored correctly, a patient can quickly go into DAGE toxicity. And so for the normal ranges for digoxin, it's usually 0.5 to 2 nanogram per milliliter. So what happens is that usually when you give someone digoxin after 8 hours, you need to draw blood, take to the lab, and then have the levels checked to see if you are within the normal ranges or it is subtherapeutic or we are getting into toxic levels. And then that helps you to further manage the patient properly, either to give top-up medications to try and get to the normal levels or to reduce the amount that is being given to stay within the normal levels. So one will ask, what then do I do when my patient gets to digoxin toxicity? There is an antidote which is usually given for digoxin toxicity. Usually we refer it as Digivan, and that helps with digoxin toxicity. But now, as a nurse, what signs and symptoms do you see that point you to your patient probably having digoxin toxicity? I've got a few of them, but usually they are GI symptoms. So nausea, vomiting, anorexia. One of the main things that when you see your patient that is receiving digoxin complain of should tell you that the person is probably experiencing some digoxin toxicity. Other things like confusion and dizziness and fatigue are also present. But the one other thing that is very important is vision changes, which is usually tested on the NCLEX. So when a patient on digoxin has vision changes, vision is becoming blurred, they are now seeing color changes and they are seeing halos around light, then that's indicative that the person may be experiencing digoxin toxicity. And so you need to take bloods and then see the levels and then give the antidotes if needed. So we've mentioned the things to look out for that may indicate that a patient is having digoxin toxicity. What are the nursing considerations you should be doing as a nurse? What things should you be monitoring? What things should you be looking out for? The very first thing is the blood pressure. So we say that digoxin helps you to reduce your blood pressure. And so once someone is on digoxin, there needs to be a constant monitoring of their blood pressure to make sure that it doesn't go below that a person may now become hypertensive. The other thing is what we call the apical pulse, the apical pulse. So we need to measure the pulse, and then there are certain parameters we need to be looking for before we can actually give digoxin. So for adults, we are looking for a pulse that is above 60. For children, we want a pulse above 70, and for infants, we want a pulse above 90. Now, one of the things that may be asked on the NCLEX is how to check the apical pulse. So to check the apical pulse, you can actually listen to the apical pulse in your left fifth intercostal space or at the apex of the heart. Sometimes this is referred to as the point of maximum impulse. So these are the words that may be used to describe the heart rate and the apical pulse you are looking to find before you administer digoxin. Also, we need to monitor electrolytes, especially potassium. The reason is that hypokalemia is a leading cause for digoxin toxicity. And so it is important that we look at hypokalemia and measure it as well. Hypomagnesemia and hypercalcemia can also contribute to digoxin toxicity. We also need to do fluid and electrolyte monitoring. So I mentioned the electrolytes earlier. Usually we monitor fluid and electrolytes together. So we are looking at maintaining straight fluid intake and output. Usually we do daily weights, and in some occasions we may do fluid restrictions because we know that in heart failure, we don't want excess fluid in the body because that just increases our weight gain and causes the heart to even beat more, which we don't want it to be doing when it is actually failing. And as well, you need to monitor for signs of toxicity because we mentioned that digoxin has got a very narrow therapeutic index. It is also important to note that certain group of patients at increased risk of digoxin toxicity. Now I want to mention that digoxin is mainly excreted throughout the body via the kidneys. And so individuals who struggle with kidney injuries, as well as the elderly who have got a reduced GFR at increased risk of digoxin toxicity. Now, how do we educate our patient who is on digoxin? Now, it is important for the patient because most often than not, this medication to be taken for a lifetime. And so it is important that we educate the patient on the things to look out for and what to report to the doctor or the primary healthcare provider. And the very first thing is to teach them to identify the signs and symptoms of digoxin toxicity. And we mentioned that it is usually G related. So the very early warning signs you will see are nausea, vomiting, anorexia. And then we also mentioned that vision changes are very important. And so once you start experiencing any vision changes, you should be reporting that to your GP. So for most patients who are on digoxin, they are probably likely going to be on some form of diuretic. And usually most of these ones are potassium wasting diuretics. So we want to encourage them to eat food that are rich in potassium, avocados, bananas, fruit juices, just to try and keep the potassium levels high, because we understand that hypokalemia is one of the main causes, or one of the main things that can cause someone to have digoxin toxicity. Now, the other thing is to do regular electrolyte monitoring. So you need to have your blood taken on a regular basis. So we look at the electrolyte levels and which ones they need topping up with medication, and which ones we can actually encourage you to eat proper, or to eat food that are rich in that type of electrolyte. And so you are maintaining a good electrolyte level so you don't have toxicity. We also need to teach our patients how to measure their pulse and when to report. So any pulse below 60 or any pulse above 100 should be reported to your doctor. So there's monitoring that can be done, or before the digoxin is actually given. So that will be all for today's video. We tried to explain what the digoxin is, its uses, and how important it is in the treatment of heart failure. I hope this video gives you value for your time spent on the page. If you did like it, kindly leave a like, share the video, put a comment down below, and we would come and then address it as soon as we possibly can. And like I mentioned, this is a series on heart failure. And so if you have not covered anything in this video, we are looking forward to putting up more videos on this subject. And so bear with us, and I'm sure it will come onto your timeline very soon. Thank you for watching. See you in the next video. Bye-bye.